Hello and welcome to our presentation of illegal and legal substances and methods to enhance performance and recovery. We'll be looking at primarily in this presentation, this first dot point here, looking at the perceived benefits and potential harms as a result of using these legal and illegal substances or methods. And so if we look back on the history of the use of drugs in sport, they've been used for centuries. Even back with the ancient Greeks, they used to make potions. The Romans have used plant extracts and herbs, all with the frame of mind of them enhancing performance. Then Tommy Simpson here, he was a cyclist. He actually died after using stimulants, and that was on television. And it really rocked the athletics world. And so the International Olympic Committee became involved and produced the first list of banned substances. So they started introducing drug tests in the 1968 Olympics for the first time. Then drug use still did continue into the 70s with the use of steroids by the East Germans. In fact, some of the younger participants were told to take the drugs and not tell their parents. And that all came out many years later, and there were sanctions for the people that administered these drugs. Also in the 1980s, that continued on to the use of growth hormones. Then in the 1990s, EPO, as well as blood doping, which Lance Armstrong was or has been outed for using. And Ben Johnson, and so he has had his tours taken from him, as well as Ben Johnson. He used steroids, and his 100-metre gold medal was taken from him back in 1988 in the Seoul Olympics. So we have looked at a number of these legal substances and methods. This presentation will focus on these illegal substances and methods. We have already looked at IV drips. Also in this presentation, we'll be looking at altitude training. So doping is the use of a prohibited substance or method that is used to enhance performance or recovery. So steroids is the first one we're going to look at. And steroids are used in conjunction with training hard, but because of the micro tears that occur at the microscopic level of the muscle, those tears result in regeneration of bigger muscle fibers and a greater number of muscle fibers, and the steroids assist in greater regeneration, increasing the lean muscle mass and therefore promoting greater muscular strength and power. This also allows for more rapid recovery after exercise, so therefore they can come back and train harder in consecutive training sessions, as well as it enhances recovery from injury, and some athletes have used steroids to help them come back after being injured. So some potential harms as a result of this can be severe acne, severe mood swings, because steroids include things like testosterone, nandrolone, and so when they inject this extra testosterone into their bodies, it can create those feelings of aggression. It can also cause damage to the reproductive organs. So as a result of injecting testosterone, the body in reaction produces more estrogen. So therefore in males, they may end up experiencing shrinkage of the testicles and the penis as a result of producing more estrogen, or even develop breast tissue. Whereas in women, if they inject themselves with testosterone, they've been found to end up with an enlarged clitoris, have a deepening of the voice, and so on. So it can also result in liver disease as well. Marion Jones, back at the Sydney Olympics, she was celebrating in winning 5 gold medals, and these were all stripped from her after it was found that she admitted to using steroids. There are a number of different case studies throughout, so feel free to look at those case studies at your leisure, and you will discuss them in class. Also, a banned substance is EPO, and erythropoietin is a hormone that's produced by the kidneys, and it actually stimulates the release of red blood cells by the bone marrow. So what that does, of course, if we have more red blood cells, we're increasing the oxygen carrying capacity of the blood, which of course then promotes greater aerobic endurance. Also, in addition to that, It helps in our wound healing process because we have greater red blood cells in order, we also have greater clotting factor, and also it assists the brain's response to neural injury as well because we can transport more oxygen to help in the healing process. What potentially can result as from taking EPO is blood clotting because we've got more clotting factor within the blood when people inject themselves with EPO and synthetic EPO because the body does naturally produce EPO. Also, there's an increased risk of stroke because of more clotting of the blood. This, of course, actually places more stress on the heart, not only because of the thicker blood or increasing the viscosity of the blood because of the greater number of red blood cells, but also increasing the blood volume. So therefore putting more pressure on the heart, increasing blood pressure, and can potentially cause a heart attack. Let's go ahead and look at the enhancement of oxygen transfer. This process is known as blood doping. Blood doping is where they remove an amount of blood, and this is what Lance Armstrong and his US postal team were known to be doing, and they would leave the blood out for a period of time, so the body's response to that would be to make more blood, and then they would inject themselves with that blood after a period of time to try and so therefore they've got once again greater number of red blood cells, increasing the oxygen carrying capacity of the blood, so therefore increasing their VO2 max, and also of course it's promoting greater recovery, which was perfect for the cyclists on days in between days during the tour. So some potential harms with this one, because they're injecting themselves with their own blood, they could potentially inject themselves and with their own blood that has become toxic because it's not being stored properly. It can also cause a reaction to the transfusions, and also they're at risk of infectious diseases as a result of using needles. So they can receive an infection from this, such as hepatitis A or B. Also, as a result of taking the blood out of the body, it can result in dehydration because there's a reduction in blood volume, which then can cause headaches and so on. When they re-inject themselves or retransfuse that blood back into the body, it's known to create or feel like the blood is being cooled down. And that, of course, once again, similar to synthetic EPO, that can increase the risk of stroke, increase stress on the heart, and increase blood clotting. Let's go back to growth hormone. Human growth hormone, similar to EPO, does occur naturally in the body. It helps to stimulate cell reproduction, regeneration, and growth of the cells. It is produced by the pituitary gland in the brain. And what it does is it actually enhances height. So it promotes bone growth and muscle growth. So synthetic growth hormone was originally given to children who had growth problems and weren't producing enough growth hormone. And so it's been taken and used by athletes in order to promote their performance. So by obviously promoting greater muscle mass, greater height can give them distinct advantages in their sports. Also, it increases protein synthesis and muscle mass, but it also is thought to result in an increase in the use of fats as a fuel for energy. So therefore, it can result in a decrease in fat stores in the body, increasing the power to weight ratio as well. However, there are many recent studies that haven't been able to support claims that growth hormone can enhance physical performance. Some other benefits potentially have been found that it strengthens connective tissue, decreasing the likelihood of injury, and promotes greater recovery from injury as well. Some disturbing potential harms as a result of this is a condition called acromegaly, and that's when there is too much growth hormone in the body. It's irreversible and it's excessive growth of the bones. So particularly in the hands, the face, the feet, the skin also really thickens, and they look quite disfigured, some of these people that have suffered from this condition. It can also, because it's produced in the pituitary gland, excessive use can create a tumour in the pituitary gland. This can cause headaches, impaired vision, and potentially, obviously, cancer, as well as heart disease and high blood pressure because the excess muscle mass putting extra pressure on the heart. Gene doping is an interesting one and gaining more recognition in recent times. It is found to lead to an improvement in performance depending on what gene is manipulated. So the definition here is the non-therapeutic use of cells, genes, genetic elements, or the modification of gene expression. So what that means is modifying the DNA that make up our genes in order to enhance performance. So an example may be modifying the DNA that controls hemoglobin production. And therefore, if they can manage to increase the hemoglobin production, that can enhance the oxygen carrying capacity. And the potential dangers and side effects are unknown, but I'm pretty sure we can safely say that gene doping can potentially be dangerous when we're messing around with our structures and our makeup of our body. Diuretics are a substance that some people have been known to take for different reasons. Some athletes use it because it helps get rid of body fluids. So therefore, they use it to try and get rid of excess body fluid or weight. So they try and make their weight restrictions. So whether or not they are a rower, a boxer, potentially a jockey for horse riding. So therefore, they're trying to make their weight restrictions. So they try and get rid of their body weight to do that. So they're known to take diuretics, as well as diuretics are also used to flush illegal substances out of the body. So if somebody potentially knows that they're due for testing, they may take a diuretic to try and hide and mask any other drugs that they may have taken. So some potential problems with this is dehydration, because they've got rid of the body fluids. This can cause headaches as a result of dehydration. Also kidney failure by putting pressure on the kidneys to get rid of those body fluids, as well as heart failure. Stimulants are substances that can be taken as tablets or powders, and they have a number of different benefits. And some different examples of stimulants include caffeine, they include cocaine, methamphetamines, as well as crystal methamphetamine, so ice. They actually enhance alertness and mental sharpness and concentration. They can improve aggression and competitiveness. They can reduce fatigue and reduce perceived exertion, so people don't feel like they're having to work as hard to produce a greater intensity. And also it can enhance resistance to pain. But some potential problems with this are addiction, also anxiety, and you can imagine because stimulants actually increase the heart rate dramatically, so it can go and cause irregular heartbeats and heart palpitations, which can also cause anxieties and insomnia. So people can have difficulty sleeping because they've got such enhanced alertness and aggression. It can cause tremors. It can cause heart regulation problems such as heart murmurs, where they get heart palpitations where it feels uncontrolled. It may result in poor coordination and balance, dizziness and blurred vision. Shane Warne is a good example of that. He was found to have taken diuretics back in 2003 and unfortunately said that his mother had given it to him so that he wouldn't look overweight on television, which was an interesting excuse for taking diuretics. Carl Lewis has also been reported, well, he has admitted to taking stimulants, as well as Andre Agassi. He has also admitted to having methamphetamines. Beta blockers is a substance that is taken to reduce heart rate for sports such as archery, shooting. What it does is it blocks the hormones such as adrenaline from binding to the different receptors on the nerves. So by doing this, it actually decreases the heart rate, it dilates the blood vessels and reduces the blood pressure. And what that does is obviously calms the body and helps with tremors as well, so that they can keep nice and calm. They can maintain a healthy heart rhythm, reduce anxiety, so that because they need to keep a really steady hand for those sorts of sports. So snooker players as well is another example for whom a reduced heart rate can enhance performance. But some problems with this include a low blood pressure, because there is a big reduction in heart rate, impaired circulation. They can end up with heart problems as well, nausea, diarrhea. Fatigue, so they feel very lethargic and fatigued and dizzy. It may affect their vision, which obviously is not going to enhance their performance, but this is what can happen as a result of long-term use. Hallucinations, insomnia, depression, as well as sexual dysfunction.